So next topic update was on localized dMMR rectal cancer patients. So we have had this study published several years ago showing 100% response rate. So this is an update on 49 patients. So this patient received dostarlimab, which is a PD-1 blocking agent for 6 months, and median follow-up was 21.5 months. None of these patients received surgery or chemotherapy or radiation therapy. As you can see, 100% patients were clinical responder and achieved complete clinical response. And then 37 of these patients had completed 12 months of follow-up, and the CCR was maintained at 12 months. And grade 3 or 4 side effects were actually quite low, 4%. There were no treatment-related death. So this is another remarkable treatment option added to our arsenal. And last but not the least, the Podium 303 study in metastatic or recurrent anal squamous cell cancer patients. For a long time, chemotherapy was the standard of care for this group of patients. So this randomized study investigated chemotherapy versus chemoimmunotherapy, in which retifanlimab, another PD-1 blocking agent, was added to the standard carboplatin and Taxol. The progression-free survival, which was the primary endpoint, improved significantly from 9.3 to 7.4 months with a very strong p-value. And based on this data, FDA has approved this combination in the frontline setting for this group of patients. So to summarize, we have a new standard of care based on atomic study for resected stage 3 dMMR colon cancer patients. For the metastatic BRAF V600E mutant colorectal cancer patients, now we have a new first-line treatment option, which is a combination of FOLFOX and encorafenib and cetuximab. The doublet immunotherapy with EP and Nivo is another option in the frontline setting for dMMR metastatic colorectal cancer patients. We have to remember about structured exercise in resected stage 2 and stage 3 patients. They improve disease-free survival as well as overall survival. For mismatch repair deficient localized rectal cancer patients, primary treatment should be PD-1 blocking agent, which achieves 100% response rate, and these patients do not require any radiation or chemotherapy or surgery. And last but not the least, immunochemotherapy is the new standard of care for the frontline treatment of metastatic or recurrent anal squamous cell carcinoma patients.